Hello, my name is Jessica Wright, and this is my PowerPoint presentation for my capstone project based upon report, developing a template for nursing shift report in the neonatal ICU or NICU. The agenda of my PowerPoint is as follows. The purpose of this PowerPoint is to provide data supporting the use of a tool or template for shift report within the NICU. The desired effect of the utilization of this tool being improvement in communication and therefore patient safety and satisfaction subsequently improve. The template is specific to the NICU and will help nurses share pertinent information in regard to current clinical situation, a thorough medical history, current needs of the patient, current medications, current medical orders, and social and cultural information relative to the patient and family. The intent of this tool will be to reduce confusion and improve communication overall by the nursing staff. By using a template, the expectation of information to be shared would be uniform and easy to understand. This will clear up confusion among staff nurses with regard to proper expectations of report and also will help nurses to share information more specifically without the assumption of a specific knowledge base. Also included within this PowerPoint is information related to evidence-based research supporting the importance of a thorough nursing report, potential complications related to implementation of the report tool, potential improvements in processes, and predicted issues regarding the challenges related to implementation. There are endless benefits to adopting a uniform report tool. NICU patients are quite complex. They are not able to communicate or validate information. Therefore, a thorough knowledge of the patient is an integral part of providing safe and competent patient care. Of the many interventions that neonatal clinicians are rigorously trained to perform in the NICU, communication skills have not systematically been included. Quote by Boss, Urban, Barnett, and Arnold. Communication has a profound impact on the patient care. Another quote by Boss, Urban, Barnett, and Arnold. Traditional education for healthcare professionals has assumed that communication skills are innate and not deserving of structured educational interventions. Yet data suggests otherwise. Families whose loved one has been hospitalized with a life-threatening illness consistently describe clinician communication to be difficult to understand, conflicting, brief and infrequent, lacking in compassion, and even misleading. Intensive care clinicians commonly report intra-team conflicts, most often between physicians and nurses, which are regularly attributed to failure of communication and which adversely can impact patient care. Improving communication of the NICU staff will in turn improve the nurse-family relationship, as the family feels confident in the nurse's knowledge of the plan of care, which can help put their minds at ease. The unknown facets of the NICU can be incredibly intimidating for the families of these delicate patients. The loss of control and inability to independently care for their child can significantly increase stress within the family. By taking a family-centered collaborative approach, the healthcare team can assist the family in stress maintenance and reduction. Whereas the stress of having a sick child cannot be completely eliminated, there are valuable steps the healthcare team can take in order to help families keep stress at a manageable level, with the goal in mind of achieving a better outcome for both family and the baby alike. Health assessments performed by the nurse is a collaborative partnership with the client that promotes mutual input into decision-making and planning to improve clients' health and well-being. Communicating this information between nurses is an integral part of collaboration and family-centered care. The tool format. An effective tool utilized by numerous healthcare providers at present is the sbar. The use of the sbar format is a succinct way to share critical information with physicians and other team members about sudden changes in a client situation. sbar stands for Situation, Background, Assessment, and Recommendation. sbar, Situation, Background, Assessment, Recommendation, is an effective and efficient way to communicate important information. sbar offers a simple way to help standardize communication and allows parties to have common expectations related to what is to be communicated and how the communication is structured. sbar allows for an easy and focused way to set expectations for what will be communicated and how between members of the team, which is essential for developing teamwork and fostering a culture of patient safety. Teaching the sbar format and familiarizing nurses with an effective way in which to convey relevant information to the members of the healthcare team is a vital component to the continuity of care. There are numerous formats for communication among healthcare providers. These tools are designed to be situationally specific, however, the baseline information remains among all of these tools, the baseline information being the situation, background, assessment, and recommendation or needs. Adaptations of this format for the NICU needs to include detailed history, social and cultural information, and the goals of the care and the care plan and the needs of the patient. All healthcare entities should adopt and utilize communication tools in an effort to providing the healthcare team members with a format that accommodates the expectations needed for continuity of care. Issues in implementation. I believe the only reservations regarding the implementation of this tool to be resistance to change. I believe if this tool is introduced in a fashion that exemplifies the simplicity and also the thorough nature of the information shared in relativity to improved patient care and improved communication overall, the staff would be innately receptive to utilizing this tool. On slide 11, you can see a list of my references. Thank you for your time.